This afternoon you discussed the strategies to improve the outcome in patients with locally advanced pancreatic cancer. Could you emphasize the role of radiation therapy in this patient population?
Yes, this is a big challenge because we know that locally advanced is by definition a locally disease, and therefore a local treatment makes sense. And the best local treatment we can do outside of surgery is chemoradiation. But on the other hand, we know also that the great majority of patients will finally die from distant metastasis, and this is also an argument to defend the concept of chemotherapy, even if it's a locally advanced disease. And this challenge has been studied in the past with retrospective studies, where maybe the best possibility is to begin with a chemotherapy in order to select patients non-progressive after 3-4 months of treatment, and then to give them chemoradiation. And this topic was examined through a randomized phase 3 study, the LAP-07 study, where unfortunately the study was totally negative, meaning that administering chemoradiation therapy after control with chemo does not provide any overall survival advantage as compared to continuing chemotherapy. But in this study, we also know that secondary endpoints seems to be in favor of chemoradiation, such as PFS, which is borderline significant in terms of statistics, but also in terms of local control and in terms of time after completion of treatment, while the patients had no progressive before to begin a second-line treatment. So the door is not closed, but at the present time we can say that there is no place for chemoradiation in locally advanced cancer after the LAP-07 study, meaning to the overall survival disadvantage or non-advantage. But there is a window in order to see what we can do in order to improve the chemoradiation or the strategy for chemoradiation for these patients.
What strategies do you propose to improve the outcome of LAPC patients, and which studies are ongoing to study these strategies?
Well, it's a difficult question. I mean that we can have some tracks which deserve to be studied. The first one is probably to improve the chemotherapy alone. Meaning that at the time of LAP-07 study, the standard of care was gemcitabine, and now we have much more active regimens such as FOLFIRINOX or nab-paclitaxel plus gemcitabine, and maybe FOLFOX plus nab-paclitaxel. That's the first point, meaning that if we are able to have a better control with a systemic disease, maybe we could have an improvement in the outcome for patients. The second point is maybe to improve the chemoradiation itself by increasing the dose or to modify the volume, the radiosensiter, and so on. The third point is that we could hope to have a better understanding of the personalized medicine with biological markers in order to select which could be the best treatment for each patient. We have some negative information this afternoon concerning SPARC, for example, and very discrepancies between the hand-to-hand problem. The hand-to-hand difficulties are probably related to the type of the monoclonal antibody used, where with one monoclonal antibody it seems to be a predictive factor for gem efficacy, but with another monoclonal antibody it has no evidence for that. So many work are ongoing in order to standardize the best way to determine the true hand-to-hand positive value for gemcitabine. But there is a lot of other biomarkers which could be interesting in the next future. Many studies are running for that purpose. One of the difficulties we have is that in pancreatic cancer we often have very, very small tissue samples, and it's very difficult to make all the assays we could hope in order to choose the treatment. And finally, another track could be to modify strategy, and maybe it could be possible to treat patients with a systemic chemotherapy for a longer time in order to better select patients who truly have a localized disease, and then those patients could more benefit from chemoradiation if it's possible to do that. Anyway, it's a long way with many challenges, and we can hope that in the next future we will be in a better situation to have better strategies and to improve the outcome of patients.